Hello and welcome to the Medicare 101 video presented by 5-Star Insurance Group. 5-Star Insurance Group is located on 119 North McCarthy Road in Appleton, Wisconsin. We serve Wisconsin, Arizona, Florida, North Carolina, and Texas. The agents at 5-Star Insurance Group are Patty Jo Heinrichs, the CEO and owner, myself, Justin Zastro, Megan Massert, and Kenda Junyon. We handle a number of different insurance types. We handle Medicare, which is what this video is about today, as well as individual insurance, also known as marketplace insurance, and private insurance as well. We do dental, vision, hearing plans, travel and trip plans, cancer, critical illness plans, hospital indemnity, and then life insurance. On today's agenda, we're going to talk about Medicare and how it works. We're going to talk about your different Medicare options, such as Medicare supplement plans, prescription drug plans, and then Medicare Advantage plans. We're also going to talk about when you can enroll and what the benefits are of using 5-Star Insurance Group. So let's start by talking about what is Medicare. Medicare is a federal health insurance program, and in order to get on Medicare, you have to be 65 or older or have End-Stage Renal Disease or Lou Gehrig's disease. You also can get on Medicare if you have been disabled and receiving disability benefits for 24 consecutive months. Alright, so let's start by discussing Original Medicare. Original Medicare will begin on the first day of the month that you would turn 65. Or, if your birthday is on the 1st, it'll start the month prior. If you're already collecting Social Security, you will receive your Medicare card typically 3 to 4 months prior to your 65th birthday. It'll come in a 6x9 envelope, and if you're already collecting Social Security, you don't need to enroll. Otherwise, if you're not collecting Social Security or you're waiting to collect Social Security until you turn 65, you would need to either apply online or call your Social Security office and make an appointment. If you're going to continue working after you turn 65, or you're going to be on somebody's plan through their work after you turn 65, if the employer coverage has more than 20 employees, Medicare is going to be primary, and your health insurance through the employer would be secondary. If you want to, you can delay your Medicare Part B so that you don't have to kind of pay extra premiums for coverage that will be duplicating itself. Once you lose this coverage through an employer, you will have a special election period that you can get onto Medicare Part B. As long as you enroll in Medicare Part B, within 8 months of losing that credible coverage, you will not get a penalty. If you delay your Medicare Part B, or you don't take Medicare Part B for any amount of time, there will be a 10% annual penalty without that credible coverage. So you want to make sure that you get on Medicare Part B as soon as you can if you're going to delay it. With the parts of Medicare, we've already kind of touched on it, but there's Medicare Part A, which is hospital, Medicare Part B, which is medical, and then there's also Part C, which is Medicare Advantage. It's the exact same thing. And then there's also Part D, which are the drug plans. Part A, the hospital coverage, covers things like inpatient hospital care, home health, hospice, 3 pints of blood. For 2026, the premium will be $0. There is a deductible of $1,736 per benefit period, and then there's copays after that deductible. Also, there's no out-of-pocket limit, so at no point is Medicare going to say, hey, you've paid enough money, we've got it from here. You'll also notice that I mentioned that it's a per benefit period, not an annual amount. What this means is that if you go 60 days without a hospital stay, this deductible resets, meaning you could possibly pay this deductible multiple times a year. Medicare Part B is your medical. This is going to be things like your physicians, your specialists, if you have any outpatient hospital services, commonly surgeries, going and getting different diagnostic tests done, such as blood work, x-rays, MRIs, and then also durable medical equipment, like nebulizers, CPAP machines, For 2026, the Medicare Part B premium is $202.90 per month. Now that's the standard premium. It can adjust depending on your income. The annual deductible is $283. And then once that deductible's been satisfied, Medicare will pay 80% and you'll be responsible for 20%. Once again, there is no out-of-pocket dollar limit. Now, as you can see, Medicare all by itself, just Medicare Part A and Medicare Part B, there's a lot of holes. Since I'm from Wisconsin, I like to say it's like Swiss cheese. Full of holes, kind of stinks, you don't want it all by yourself. So what you can do is choose one of two options to kind of round out your Medicare coverage. Option one is going with what's called a Medicare supplement plan, and then also buying a Medicare Part D plan or having some type of credible Medicare Part D coverage. The other option is taking Medicare Advantage, which combines the parts of A and B and then adds on some additional benefits, and most of those plans also include built-in Part D drug coverage. So let's start with Medicare supplement plans. Medicare supplement plans are offered by individual insurance companies to pay secondary to Medicare. So Medicare would be your primary, and then your supplement plan would come and pick up whatever Medicare left behind. So things like those deductibles, that 20%, things that would fall under that nature. You can enroll in a Medicare supplement plan either with guaranteed issuing or with underwriting. The nice thing about a Medicare supplement plan is that as long as your provider that you want to see accepts Medicare, it works. There is minimum prior authorizations, no referrals, and they're generally easy to use. They work great out of state, and it's a much easier way to have an idea of how much your cost is going to be, because you're paying a premium for the supplement plan, but it's going to pick up most of those additional costs that Medicare leaves behind. Now, if you do any research on your own and you start researching Medicare supplement plans, there is something that you need to know. Wisconsin does not offer the standardized letter plans that most other states have. So plans like F and N and K, they don't exist here in Wisconsin. Instead, what we offer are base policies with riders, and there's also some plans where you can choose to have a copay for a slightly lower premium. Examples of the riders that are included in a Medicare supplement plan is you can choose to get a rider that covers all of the Part A deductible. So no longer will you have to worry about that deductible every 60 days you have a hospital stay. You can either choose to get it in 100% coverage or 50% coverage. If you turned 65 prior to January of 2020, you can choose to also have your Medicare Part B deductible covered by a rider. For anyone that turns 65 after that date, you do not have this option. Like I mentioned, you can choose to have a copay rider, which will help lower your premium in exchange for a copay. You can choose to take a rider on the Medicare Part B excess charges. I like to say that this is the billboard doctor rider. Doctors who accept Medicare but don't necessarily agree with Medicare's rates are allowed to charge you 15% of the difference between what they billed and what Medicare said was the usual and customary rate. If you take this rider, it will cover you of that 15%. So a lot of times I kind of joke around with people that if your doctor thinks that they're good enough for a billboard, chances are that they think they're better than Medicare's rates. So this is a good rider to have. You can also choose to get a rider for additional home health care. Medicare only covers a certain number of days annually. This will help boost those number of days in the event that you have a home health stay. You also can get a rider that will help cover you outside of the country for emergency benefits. Now this isn't just, casual, oh, I'm going to go to Canada to go get a mole removed. It has to be an emergency. But it is a nice option to have, and it's built right into your premium. Wisconsin also has a number of mandated benefits that are required by our state to be considered by your plan, even if Medicare normally wouldn't cover them. They are required to pay up to the usual and customary rate. So again, if it's possible that your doctor may charge more than what the benefit will pay, and that's just because they're charging above that usual and customary charge. Some examples of these things are cancer clinical trials, chiropractic services beyond just the back cracking, the manual adjustments, diabetic equipment and supplies, skilled nursing facility care, colorectal cancer screenings, and then also breast reconstruction. Now this is just some of the things. This isn't a full list. You can always ask for more information in that or do some research online. In order to enroll in a Medicare supplement plan, the first thing you have to know is you have to have both Medicare A and B to get on one of these plans. There is a 6-month enrollment window when your Medicare Part B starts, and you will be guaranteed issued into that plan regardless of your health history or your current status. So if your birthday starts in January, you would have until June to get onto a Medicare supplement plan with no questions asked. If you waited past this 6-month window, then what would happen is you would be applying for the Medicare supplement plan with underwriting, which means that they would look at your health history, they would look at any of your prescriptions that you're currently taking, and they would determine if they're going to issue you a policy with a slightly higher premium, or decline you. A lot of times here in Wisconsin, people will tell me, oh, well, I heard if I don't get on a supplement plan, I'm never going to be able to get on one after that 6-month window. The reason why they are saying that is because they're afraid that they wouldn't pass underwriting. So just keep that in mind. Let's move on to Medicare Part D. Medicare Part D is also known as prescription coverage. Once again, it is offered through private insurance companies to you, the customer. You have to be enrolled in Medicare Part A, and then you can also have Medicare Part B. Part B is not required to get onto a drug plan. You have to have A though. You also have to live in your plan service area. So if you currently have a Medicare Part D plan and then you move to a different state or to a different area, you may have to change your prescription drug coverage. Medicare every year will set a guideline on what the minimum standard is for a prescription drug plan, and all prescription drug plans have to meet that minimum standard. No plan can be worse than what Medicare determines as the base level plan. You have to have Medicare prescription drug coverage or some type of credible coverage once you turn 65, because if you don't, you will be assessed a 1% penalty for every month that you didn't have prescription drug coverage and you could have, which this year for 2026, it's 1% of $38.99. So if you went 6 months without any drug coverage, you would have to pay 6% of $38.99 every single month for the rest of your life once you have that drug coverage. So if you go 2 years, now it's 24%. And this will apply every single month for as long as you have prescription drug coverage. This is partially why I said you want to make sure you have some type of drug coverage or credible coverage to go with it. In 2026, there are 3 stages of a prescription drug plan. There's a deductible, which is $615 base level. It could be less than this. It can't be more than this. Once you've satisfied that deductible, you move into the initial coverage phase. During this phase, you would pay a copay or a percentage based on the tier of your medication. A lot of times in the past, Tier 1, Tier 2 medications would either have a very low cost or possibly no cost. So if you ever heard somebody, I pay nothing for my drugs, they were probably on Tier 1 or Tier 2 medications. In 2026, it's a little bit different. There have been higher copays for things, and more drugs have that coinsurance as well. So just be understanding that every year it's a little bit different, which makes things interesting to say the least. You can see that in this grid here during the deductible phase. As you can see here with this grid, during the deductible phase, you would pay 100%. In the initial coverage phase, your cost can't be more than 25% of the cost of that medication. The Part D plan would roughly pay about 65%, and then the drug manufacturer pays about 10%. Once your out-of-pocket maximum reaches $2,100, then you would be covered in full. Your drug plan pays 60%, the drug manufacturer pays 20%, and then Medicare pays 20%. But prior to that, you're going to be paying some of that cost. The other nice thing to know is that for that true out-of-pocket, that $2,100, your deductible, the amount that you pay during the initial coverage stage, and the amount that the drug manufacturers pay all contributes to that $2,100. So while your out-of-pocket is $2,100 for drugs, you might not actually pay that depending on the cost of the medication and how much the drug manufacturer had to pay for it. Again, once you hit that $2,100, you'll be covered in full, as you can see here. Once again, when you reach the catastrophic phase, there is no cost for any drug coverage. For the rest of the year, as long as your drug is covered, it will have no copay. Now, if you are on any experimental medications or you get any medications from Canada or from Mexico or any other country, and you're not using your insurance to get those don't count. Same thing with like over-the-counter items, vitamins, things like that. You might have some level of coverage based on your plan, but those things do not contribute to that catastrophic $2,100 limit. If you're on a number of expensive medications or you're struggling to pay the cost of those medications during both the deductible and the initial coverage phase, there is a program called Medicare Prescription Payment, which is also known as copay smoothing, MP3, and it started in 2025, and what it did is it stretched out the cost of your medications over the course of a whole year rather than making you pay right at the pharmacy. Makes things a little bit easier. You set it up directly with your carrier. It is managed by a third-party company, so even if you change plans, you'll still be able to make your payments to it. But it is a nice way to help alleviate the cost of those medications, especially if you're picking up quite a few of them every month. Now, you might be asking yourself, what if I'm not on any medications and I don't really need drug coverage, but I also don't want to get a penalty? In the state of Wisconsin, we have a program called Wisconsin Senior Care. This program is an income-based program, which means that you have a different level of coverage depending on your income. It has a special enrollment year-round where you can use this program to get onto a different prescription drug plan if you're enrolled in it. Also, this program acts as credible drug coverage. So you can get on Wisconsin Senior Care and then you don't have to worry about that penalty. So this is a really nice option for people who maybe want to have some prescription protection, they don't want to get the penalty, but they also don't have a prescription need and therefore maybe they don't want to pay a premium. In order to get on Wisconsin Senior Care, you do have to be 65 years old or older. You have to live in Wisconsin and you have to write a check for $30. If you have if you have questions on Wisconsin Senior Care, you can always reach out to our office or stop in and we can hand you some information. Also, there is a program called Low Income Subsidies, also known as LIS, which is offered directly through Social Security. It reviews your income and your assets and determines whether or not you may qualify for some assistance on both your medications and your prescription drug plan's premium. It could help reduce your copays, it could reduce your premium, and if you had that late enrollment penalty, you may qualify for that to be removed as well. Again, this is handled directly through Social Security. It is not handled through an insurance company. Other options that are always out there for prescriptions is things like international pharmacies, like Farm Store, Cost Plus Drugs. There's patient assistance programs if your medication is a very expensive medication or is maybe not covered by your insurance. And then sometimes your drugs might be cheaper through a drug discount card like GoodRx or SingleCare. For example, I had a customer call me today and he told me that one of his medications, if he was to get a 90-day supply through a mail order pharmacy, it was going to be over $600. While if he used GoodRx directly at a retail pharmacy, it was only going to be $15. So if your drug feels like it's maybe a little bit more expensive than what you think it should be, there are other options out there, or at least you can see if there is an option for your medication. Now, some medications, very expensive medications that are on TV, you're probably not going to get a discount for those through GoodRx, but for some more everyday medications, there are options out there. Now, I know you're watching this video, but this is always a good opportunity to ask some questions. So feel free to pause it, put a comment, or email us your question. Say, hey, I'm watching the video and I wanted more information on this. Once you're ready, feel free to push play, but otherwise, if you want to pause for a second, go to the bathroom, get yourself a snack. We're going to move on to Medicare Advantage. All right, welcome back. Let's get started with Medicare Advantage programs. Medicare Advantage plans are also offered through private insurance companies. In order to be on a Medicare Advantage plan, you have to have Medicare Part A and Part B, and you must continue to pay your Part B premium. Now, you've noticed that we've said that you need to have Medicare Part A and Part B a number of times. The reason for this is that every once in a while, somebody gets this idea in their head that, hey, I've got this Medicare Advantage plan, or I've got this Medicare Supplement plan. I don't need my Medicare Part B. I don't need to pay that premium to the Social Security every month. I've got this cool plan. No. If you cancel your Medicare Part B, it will cancel your Medicare Advantage or your Medicare Supplement plan. So it is very important that you have both Medicare Part A and Part B if you're interested in a Medicare Advantage plan. I like to describe it to my customers as Medicare Part B is kind of like the key to the car you want to drive. If you want to drive an Advantage plan or a Supplement plan, you need that key in order to drive that car. Also, for a Medicare Advantage plan, you have to live in the service area, so similar to a prescription drug plan, if you move, you may need to change plans, but this will open up a special enrollment period. Medicare Advantage plans are contracted by Medicare to pay the bills for Medicare. So when you take a Medicare Advantage plan, all of your claims go directly through the Medicare Advantage plan. Nothing gets sent directly to Medicare as far as your claims go. So another common misconception is that, oh, well, if my Medicare Advantage plan won't cover it, then Medicare will. Incorrect. If you have a Medicare Advantage plan, that is your insurance. Also, with the Medicare Advantage plan, it bundles both your A and your B benefits together into one card, so you don't need to carry around multiple cards. And a lot of times, like I had mentioned earlier, Medicare Advantage also includes drug coverage. With the Medicare Advantage plan, they are cost share plans, meaning that you will pay copays or a percentage for your services. You go see your doctor, you pay a copay. Go get an MRI, you pay a copay. Go have cataract surgery, pay a copay. And a lot of preventative services are covered at 100%, and Advantage plans commonly will cover services and preventative tests that normally aren't covered by Medicare. Some Medicare Advantage plans will require authorizations for certain services, things like inpatient stays, inpatient surgeries, diagnostic tests that are a little bit more extreme than others. So that is something that can happen. They also have an out-of-pocket maximum every year for your health care, which means on any Medicare Advantage plan, they will have a maximum out-of-pocket that says, hey, you've suffered enough, we've got it from here. Once you hit that out-of-pocket maximum, you'll be covered at 100% for future covered services on your Medicare Advantage plan. Also, with the Medicare Advantage plan, a lot of them will include some extra benefits, not all of these necessarily, but some extra benefits such as dental, vision benefits, hearing, fitness coverage, and over-the-counter items. There may be other services as well. Each Medicare Advantage plan is unique and offers things that it wants to offer. With Medicare Advantage, there are a number of different types of plans that you want to be aware of. With an HMO plan, typically the out-of-pocket costs are going to be a little bit lower, but you are sacrificing some freedom and choice when it comes to picking which doctors you want to go to, which hospitals you want to go to. HMO plans commonly will require referrals in order for you to go see a specialist and will not cover services if you don't have those referrals. With a PPO plan, you may have slightly higher copays, but you will also have access to both in and out-of-network benefits. So this is a great option for a lot of people who like to be able to go to the specialist they want to go to. They do a lot of traveling outside the state. PPO plans are a lot safer and easier to use, and they don't require referrals in order to go see those specialists. There's also what are called private fee-for-service plans. These plans basically negotiate with your provider in order to determine what's going to be covered and how much your out-of-pocket cost is going to be. These plans are not very common, but there are still some out there. Lastly, there are MSA plans. These are medical savings account plans. Basically, what these plans do is they provide you with a level of coverage with a high deductible. And then what they'll do is they will put some money into a savings account that you can use towards helping satisfy that deductible. Usually you have to go a couple of years before you will actually save up enough money in order to, satisfy that deductible. But if you are relatively healthy, you don't go to the doctor hardly at all, and you want to kind of build up a nest egg for if something was to happen, this is a plan that's worth considering. In order to enroll in a Medicare Advantage plan, there is an initial enrollment period. If you turned 65 in April, you would have 3 months beforehand, April, and then 3 months after in order to choose a Medicare Advantage plan. When you pick the plan, it will either go into effect on your birthday month, if you pick beforehand during those first 3 months, or the month directly after. So if you waited until April to enroll in a plan, it wouldn't actually go into effect until May. If you did it in May, it would go into effect in June, it would go into effect in July, and then if you enrolled in July, it would go into effect in August. I always recommend as soon as you got your Medicare card, if you're interested in signing up for a Medicare Advantage plan, even if you're 3 months before you even turn 65, come in, go through your plan options, and have something picked. That way, once your birthday month rolls around, you're ready to go. With a Medicare Advantage plan, you can change your plan during the annual enrollment period every single year. This occurs between October 15th through December 7th. During this time, you can update your Medicare Advantage plan, you can pick a new prescription drug plan. You'll usually get a letter or a packet from your current Medicare Advantage plan in September called the Annual Notice of Change. This will go through all the changes that are happening with your plan. If they're cutting benefits, if they're adding benefits, if copays are going up, down, all of those things. It's really important that you look through this and determine, do I need to change my insurance? If you do, you come in during that time, October 15th to December 7th. We'll do an application, and then it will kick in on January 1st. Once January rolls around, there is also an open enrollment period between January 1st and March 31st where you can make one change to your Medicare Advantage plan. So if you forgot to do something during your annual enrollment period, or maybe you signed up for a plan and then it turned out it wasn't really the right plan for you, no problem. We can make that one change during January 1st through March 31st. After that point, or if you've already made a change, you are locked into that plan for the remainder of the calendar year unless you qualify for a special enrollment period. Some examples of special enrollment periods are you lose your employer coverage and now you're ready to enroll in Medicare Part B and then you want to get on a Medicare Advantage plan. Totally fine. If you move out of the service area, you won't qualify to stay on your current Medicare Advantage plan, which means that you'll have a special enrollment to get onto a new one. If you start receiving Medicaid, also known as Badger Care here in Wisconsin, or you lose that coverage, or you qualify for low-income subsidies, this is a special enrollment period where you can make a change. If you have senior care, there's a special enrollment period built right into that. If you are diagnosed with a chronic health condition, you can make a change to a chronic health plan. Or if there is one available in your area, you can also enroll into a 5-star rated plan once per year. So looking at supplements against Medicare Advantage. With the Medicare supplement plan, you're going to carry around at least 2 cards, your Medicare card and then your supplement. Medicare will pay its bill first and then forward it over to the supplement plan to Medicare will pay first and then it will forward the bill over to Medicare Supplement, which will pick up what is left over, and then if there's any additional costs that maybe you have to be responsible for, you would then have that bill. With the Medicare Advantage plan, the Advantage plan handles everything. You would pay your copay. Nothing is handled through Medicare. With the Supplement plan, as long as Medicare is accepted at the provider that you want to see, you're good to go. With an Advantage plan, depending on if you picked one of those HMOs, PPOs, PFFSs, you may have to go to certain doctors over others, or you might have a higher cost if you go to an out-of-network provider if you were on a PPO plan. With a Supplement plan, there are minimal authorizations and there's never a referral. With Advantage plans, there may be authorizations and there may be referrals, again, depending on which plan type you pick. Supplement plans, they might underwrite you based on your health history, so you could get declined. With an Advantage plan, there is no underwriting. You could literally walk into our office with a shark attached to your arm and we'd still be able to enroll you. Supplement plans, prescription drug coverage is not included, which means you have to buy a separate prescription drug plan or get something like Senior Care. With an Advantage plan, typically they include Medicare Part D coverage.